Hello, my name is Mike Ballard. I'm one of the Policy and Practice Officers at Sitra. If you've got a supporting people contract, then you'll know that the Quality Assessment Framework, commonly known as the QAF, is a really important part of that contract. It's the tool by which the supporting people teams will measure the quality of your service. It takes place by completing a self-assessment, which would be followed by a validation exercise. Whilst initially you may think it's a lot of work, all providers have said what a really good tool it is for monitoring and reviewing the standard of their own work. Assessment and support planning, health and safety, fair access, diversity and inclusion, safeguarding and protection from abuse, and client involvement and empowerment. And across all of those standards you would get 5 grades. C grade is very much the minimum grade and will show that there is scope for improvement, through to a B or an A, and an A really recognises that you're running an excellent service. Most authorities now, when they're looking at their QAF contract, when they're looking at the supporting people contract, will expect providers to achieve at least a level B. At Sitra, we've been very involved in the Quality Assessment Framework, working closely with the Department of Communities and Local Government, and as such we run a number of different courses. Those courses would look at each one of those 5 objectives in a lot more detail. Each of the objectives has a number of standards within it. One of the most important things that I would say to you if you're having to do the Quality Assessment Framework is not to wait till you get that notification from your supporting people team, but to start thinking about it now. All of the forms are available on the Sitra website, and one of the most important things that most providers struggle with is the collection of evidence, because you have to provide that to be able to show what standard you think you're at and what standard the supporting team will assess you on. So if you're having to do the Quality Assessment Framework, or if you haven't done it before, then start now thinking about collecting that evidence. Whether it's support planning, where you can show that you've done the support plan and that's got an action plan and outcomes for your clients, all of that can be used as evidence. Training for the staff can be used as evidence. Most providers will do some form of service user involvement, whether that's about the person's own service, whether it's about your service in general or your organisation as a whole. That will really count towards that particular standard. I hope you find this useful, and good luck in completing your Quality Assessment Framework.